they're going to be reducing the aid for Medicare by billions of dollars. It's obvious that services are going to be cut, especially for seniors. And there are doctors right now in Manhattan and all over that are not taking Medicare now. Once the services are cut and the payments are cut, what's going to be left?
Yeah.
Very little. Very little. And what kind of doctors are going to be left to treat us? We won't have choices. And in other words, I had knee surgery. I went to special surgery for my knee surgery because I wanted somebody who was the best to do my knee surgery. I'm not going to have that choice anymore. I'm going to have to be left with a doctor who accepts Medicare, maybe paying $8 to them, and most of them won't even take it, who maybe is not a doctor that I would have gone to had I had a choice. I don't feel I'm going to get the same type of care, and I don't think anybody will. And my only second part of this question is, if this bill is so good, why did Congress put in that they are exempt from it?
Where is that in the bill?
I think you should read the bill. I have heard over and over again.
Oh, no. Where did you see it in the bill? Not what you heard.
Well, I haven't seen the bill. I don't think a lot of people haven't seen the bill. It was supposed to be shown to us. We haven't seen it yet.
No, it's out there. It's on the
all 3,000 pages?
Yeah, the whole thing. Everything.
But I understand that it is in the bill.
From who do you understand that from?
Well, from radio shows.
Oh.
Can I ask you then, you got the bill. Are you going to be covered by our bill, Congress, or not?
Sure. We're going to have, look, I have the same right now. I have the same medical benefits as every other federal employee, as the postman and everybody else.
Right.
Okay? When I was a professor at Penn State, I had much better insurance than I have now. The intent is to have this kind of, our level of insurance for everybody. That's what we're trying to provide.
So are you going to be under this? The same bill we will be under this, or not?
Yes.
So you're not going to have the Cadillac plan that you have now. You're going to be under our plan.
It might be maybe a Buick plan.
It should be the same. And only for one reason. It should be the same because you know why? We're the employer. Exactly. And you're the employee.
Right.
The employee shouldn't have better benefits.
I imagine a number of you would complain if you had my health care, that you'd be taking a step down, actually.
I don't think
not everybody, but
anyhow, the other part of the question I would appreciate your answer to also about the billions of dollars that are going to be cut from Medicare.
Right. All right. Let's talk about that. What you're talking about is reduction of Medicare Advantage. Okay. Medicare Advantage is a program that has, well, actually hurt in terms of what it has done to the cost. For every dollar that you put into Medicare Advantage, you are getting 14 cents worth of care, and 86 cents is going toward the administrative cost and the profits of the insurance company that is providing it. So there is an enormous amount of waste there. So when you're talking about those billions of dollars, we're cutting that waste out. Okay, now Medicare with Part D now that exists with the donut hole in it, you get paid to a certain level, and then you have to $3,600 you've got to pay out of pocket before it's covered again, right? The House bill begins to close that donut hole by $500 a year until it's all the way closed. The Senate bill does not do that. The Senate bill closed at $500 and leaves the rest of it open. So you're still on the hook for $3,100 or so dollars.
Can I just ask you, I have regular Medicare and I have a supplementary.
Right.
And where is, I don't pay for a donut plan. I have, my supplementary picks up 20%, and Medicare picks up 80% of what they think is fair. So is it going to affect?
Yeah, you don't have the drug benefit yet.
No.
Okay, well that's where it is. It's the Part D of the drug benefit.
Okay, but if you don't have it, I mean, are you still, it's not the Advantage plan, are you still going to?
Then you won't see a reduction in your coverage. You'll be fine. You'll be fine. And in fact, it's not tied, it's not in the bill. It's not in the bill, but it's ancillary to what we're trying to do with the Medicare fix, is create a permanent fix for the Medicare reimbursement. The problem is, it's based on regions. In fact, this area might actually be in the New York region, which is one of the highest reimbursement rates in the country.
It is.
It is. And what's that? You're Northeast Pennsylvania? Oh, Scranton. Okay.
My county is in the Newark, New Jersey, MSA.
It is.
Yeah.
Okay. Well, in other parts of the district, out further west on Union and Snyder County, they're not. Their reimbursement rates are much lower. So it's a regional issue, actually. We're fixing that to make it well, I'm not sure the exact title this time, but we've actually in the process of writing the legislation now. We'll vote on it when we get back after Thanksgiving to create a permanent fix for reimbursement of doctors for Medicare, or their Medicare payments. So you're right to point out that there's a problem with Medicare, and you're right to point out that doctors are becoming more and more reluctant to accept it because it's 60 cents or so, 65